When joint pain is limiting your movement and impacting your life, could replacement be the answer? Local woman with 2 new hips shows how surgery helped her reach new peaks.
Runner set!
Thousands of runners filled the streets of Troy in the 2022 Turkey Trot. Among the happy, smiling faces is Allison Marinucci, with a bigger smile at the finish to celebrate her fastest 5K of the year. A stark contrast to this picture just a few months earlier when Allison had both hips replaced after 2 years of pain.
Not being able to walk properly, not being able to sleep properly. If I worked out, I paid a huge price for it.
Come back on down.
Allison is not your typical hip replacement patient. She's only 40. The wear and tear on her bones was a result of congenital hip dysplasia where the joints had not formed properly.
The doctor told me I had hips of someone in their mid-80s, so that was kind of nutty to hear.
The decision to undergo surgery on both hips came after physical therapy and other options did nothing to relieve the heavy weight of constant pain.
A lot of times what we hear is, wow, I should have done this a long time ago because the pain is gone, I feel great, and now I can get back to the things that I love doing.
That was certainly the case for Allison, who was hiking with her son just 5 weeks after her second surgery.
Hip injuries for us are up there. They're probably 60 to 70% of what we see because we typically work with more active people.
Seeing that amount of volume for hip injuries, physical therapist Patrick Suarez knew Allison wasn't responding to initial physical therapy as she should and suggested further imaging, which showed a loss of cartilage, leaving bone on bone in both of Allison's hip joints.
And it was definitely oh my gosh, that's crazy. I was relieved to know what was wrong after it just hurting and getting worse for 2 years.
I think the old teaching was wait as long as you can.
Orthopedic surgeon Dr. Matthew Tatro says that has changed as surgical techniques and replacement materials improved and patients started getting younger.
If a patient is in pain and has a diagnosis in the extent of disease that would warrant a hip replacement, you don't necessarily need to wait as long as we used to think, because one, I think you're sacrificing quality years of life.
Once the decision is made, what does the surgery entail? It takes less than 2 hours for a surgeon to remove the damaged joint and replace it with a ceramic head resting in a plastic liner and a metal stem.
In essence, we're creating a new joint by removing that arthritic head. We use a stem that goes into the femur. We use a new socket that resurfaces. The bone grows onto the implant. So this is a biologic relationship that's durable over time.
Recovery begins immediately, walking soon after anesthesia wears off, then physical therapy for several weeks to improve strength and range of motion. There are risks, as with any surgery.
Anytime you make an incision on the skin, right, there's the potential that you have nerve injury, damage to blood vessels.
And then there are risks unique to hip replacement.
Now that you have metal in you, right, any fall that breaks a bone, right, can lead to complications with the replacement itself too.
But when the constant pain that limited your movements or kept you from sleeping is gone?
Hip replacement patients in general are some of our happiest patients.
I'm glad that I did it, and I'm glad it's behind me. It feels like a gift, it really does.
Now, talking to other patients is helpful to find out what lies ahead when recovering from hip replacement surgery, which is why I'm glad a mutual friend introduced me to Allison in this story. I'll be getting a new hip tomorrow, and now you all know where I'll be for the next month, getting stronger and faster again.
Yes, and we are wishing you a speedy recovery. We know how much you love to be active, so hopefully all goes well and can't have to wait to have you back in that chair.
I'll be running after Cap in no time.
You know what, though? You are amazing, Lydia, because you've been so uncomfortable, and yet you still do everything. And I know it's going to be such a relief for you, and you're going to do great. And yeah, you'll be able to catch me. You can still, you know what? You can catch me right now with a bad hip.